Well, 2020 has been a challenging year for us, I think, from the point of view of mental health and dealing with the mental health of our customers. So it's not about always just their shopping needs, but we're one of the only businesses open during the stage 4 restrictions and other restrictions. And dealing with mental health has been very, very challenging. I know Stephanie had a particular example. Do you want to talk about that? Because that was quite significant.
Yeah, so we sort of, against mid-restrictions, I had a customer come in who couldn't access her GP, couldn't go to an emergency department of the hospital, and was very mentally unwell. So I had to use, I guess, the skills that I'd learnt from doing the emergency mental health with a PSA and talk to her and reassure her, which was very distressful for our staff at the time. But yeah, so I guess we're lucky too. We've got a consulting room, so I was able to take her in there, give her some water and have a chat to her and support her through what was a very stressful time for her, in amongst everything else we were doing. So I guess, yeah, in terms of just helping reassure people and support them through the anxiety, I guess, of the unknown has been really challenging on top of everything else. The other thing that we've sort of continued to do is things like our blood pressure testing, because people have felt quite anxious, so they want to get their blood pressure checked and they haven't found anyone, their GPs won't do it. So we've put in procedures to try and to do that as safely as we can. So people have been really grateful for that.
I think the blood pressure is interesting because the blood pressure is actually driven by a lot of the doctors who just say, go to the pharmacy, get it tested, and then if it's high, come and see me. So we've actually had a few customers that their blood pressure all of a sudden is really high, and even though they say to us, oh, my doctor doesn't want to see me, and we sort of say, well, your blood pressure's really high, you now have to go back and see your doctor. So we've had that a little bit, they just want us to do the screening, which we're happy to do.
When other services have sort of not been available and there's so much uncertainty around, people have sort of, I guess, sought solace in just coming in to get some reassurance and to feel that they've got some support from health professionals, yeah.
I had a lady on Sunday, a lovely, lovely elderly lady, who just said, I couldn't look at the four walls anymore. And I was just working and I just said, look, take your time, have a seat. How many have just come in to sit down? And they don't even want to buy anything, but we're the only place open.
It's really showcased, I think, to the community the value that we offer. I mean, they knew it anyway, but it's just really, I guess, highlighted it for the community. And it being a frontline health professional that they can just walk in the door and get advice, support, help. I think people have really appreciated that and seen it in a bit of a different light.